So now we have next speaker, Dr. Pooja KHAMAR. Her paper is winner of AIOS Apos Pradeep Swarup Award, and she is going to talk on tier biomarkers to the rescue in non-responding dry eye disease.
Thank you, sir, and thank you, AIOS, once again for presenting me with this award. At the outset, none of the authors have any financial disclosure. It's just that we have developed the kit in-house, but no financial disclosure. So we do come across patients in our clinic, two group of patients, where one respond to our dry eye treatment very well, but the second set of dry eye patients, they don't respond. And then the doctor shopping starts. They go from one doctor to the other, take multiple opinions, and in spite of doing multiple treatment modalities which are given to them, they still remain dissatisfied. So what is the hidden link here? What is the definition of a non-responder? A non-responder is someone which may have persistent or worsening symptoms and objective measures of dry eye severity, such as tear film instability, corneal surface integrity, or other relevant clinical markers which may not show the anticipated improvement following the recommended treatment plan. The global prevalence of dry eye disease is increasing, and at this point of time we have an average of 25 to 30% of the population across the globe which has been affected with the dry eye disease. It of course impacts the quality of life, affecting 60% of the patients which have reported to have affected their daily activities and leisure pursuits. And also it's a notable financial burden on the community because of the drops they use and the emotional impact they have. So time has come for us to identify the non-responders, have reassessment of the diagnosis with advanced diagnostic modalities to have a customized approach for them. So we had two research questions. One was what factors could contribute to the variability in treatment response among the patients with dry eye disease. This is the biomarker Biome Pathfinder kit which we have developed in-house, and it measures a set of 8 molecular biomarkers, a combination of inflammatory and non-inflammatory biomarkers, and it is an ELISA based kit. It is done in clinics, and at the end of 90 minutes you get this report which is like a hemogram report, where every biomarker for each right and left eye you will get what is the level of the biomarker, and based on the reference interval which is from the published literature, you can identify whether this is normal or abnormal, and we can constitute the treatment. So we recruited 5,270 patients who were presented to the dry eye clinic, and they were classified according to the TFOS due to classification, and the treatment was initiated based on that. On follow-up, we did dry eye metrics and a comprehensive dry eye questionnaire for them, and the non-responders were identified at 3 and 6 months. For these non-responders, the tier biomarker testing was done, and a customized biomarker therapy was given to them. Based on this customized biomarker therapy, the response level increased to 64%, where 64% of the non-responders were given the customized treatment based on these biomarkers, and this was the level of biomarkers which was elevated. Now, there were patients with one-fold increase, MMP9 was 10%, two-fold was 7.7%, and three-fold was 8.3%, where we gave this customized treatment with Trehalose and cyclosporin or vector pulsation therapy. At the end of customized treatment, from 27% non-responders, the non-responders rate reduced to 22.3%. In ICAM1 also, when lifitegrast was added for the treatment, the non-responders reduced to 0.7%. And with a combi IL-17, which is the pain without stain group, we gave either vector pulsation therapy or IPL, and the non-responders rate reduced from 12% to 1%. And for the patients who had combination of biomarkers, the non-responders levels reduced from 8% to 0.6%. So this just shows that if you have a biomarker report for this non-responder patients, you can actually have a targeted treatment for them to reduce the non-responders, and the total cohort had 64%, which reduced to 4.4% after the targeted therapy. This doesn't involve, like you can now say that why do I need this kit, because otherwise traditionally you have to have a lab, which does involve time, cost, manpower and resources, but here everything reduces and you get a customized report in just 100 minutes. So this is the first in the world biomarker kit which may be used to discover and stratify specific abnormal levels of biomarkers and treat them for inflammation as a targeted therapy. Customization of the treatment based on molecule of the aberrant biomarker would help us as we move forward, and more economical management by avoidance of multi-drug therapy in patients with previous treatment failures would help not just the economical constraint but the community as well. Thank you.
Thank you. I think that's a very good paper to have a targeted therapy depending on the differential increase in the biomarkers. But I just noticed you had estimated VEGF levels also.
Yes,
What
sir.
is the significance of that?
So, so I present the dry eye aspect of it, but we are aiming that this kit should not be just for dry eye patients. It
Okay.
would be for retina patients when
Okay,
you have
okay.
anti-VEGFs, ROP patients. It can also be used for glaucoma patients when it comes to inflammation. So it is for it's like it. This
It can
kit
be
is a
used for multiple
multi-purpose.
indications.
Yes. Yes.
Okay. Thank you.